For an organization to be recognized with the Davies Award, Akron Children's must have a very mature governance process. What are some of your observations on what Akron Children's does that allows your organization to nimbly scale information and technology solutions to solve a multitude of clinical challenges across your enterprise?
Good afternoon, thanks. At Akron Children's Hospital, we have robust governance on both the IT as well as on the clinical quality side. And creating liaisons and collaboration between those teams have really been the focus and key to how we've been able to drive success in improving our quality care management and standardization. We have a robust quality committee and cabinet that reports directly up to our board of directors. As well as robust governance on the IT side that, again, works collaboratively with those groups to help drive quality care.
Great. So in pediatric specialties, what are the benefits in reducing variation in care?
I think the benefits really come in seeing that standardization that's data driven. If nothing else, this pandemic has shown us that the value of data really helps to drive the quality of care that we deliver to patients. And in the pediatric space, certainly we look to the literature and the data to help drive those. And then secondly, we use standardizations with clinical protocols, order sets, smart sets within our EHR to, again, present that information that's so important to the clinicians in the right place at the right time, using informatics principles to guide that.
Great. So what happens when EHRs are used to embed interventions consistent with best practices in a clinical workflow, even with procedures as complex as surgery to treat scoliosis?
Yeah, our Davies presentation around our scoliosis center, which we're developing into a center of excellence, is really a great example of taking a truly complex problem and breaking it down into small parts that can be standardized. Thinking about the OR procedures and how all of that care from the point at which the patient arrives in the hospital all to the point at which they are discharged from the hospital being standardized and protocolized for those patients has shown both an improvement in the quality of care delivered as well as a return on investment in that work. We've seen a decrease in overall length of stays for these patients as well as a decrease in complications, again, with these really complex surgeries. And a lot of this comes down to, again, using clinical protocols which give nurses the understanding of how to manage patients in certain situations, all being standardized for those patients, as well as order sets that are, again, driven by where that patient is along their protocol.
What are some of the best strategies for driving order set compliance within an organization?
I think some of the best compliance we've seen is when our end users are engaged in the process. Certainly looking at a problem and solving a problem with engagement, I think is always a key to success. But through our Davies projects, again, as well, we've seen that those end users who understand the problems we're trying to solve and then work closely with us to develop those order sets that have those key orders that need to happen and in a time when they need to happen is when we've seen best engagement. Certainly development of our order sets for opioids, we've been able to see a tremendous decrease in the prescription of those medications, which ultimately, again, leads to better quality of care for those patients.
So how do you get specialists to abandon the way they have always practiced?
I think it's hard. Our orthopedic surgeon will always talk about transparency of data, and that was the driver for many of the changes that we have seen in the opioid work that we have done, is just making awareness, bringing awareness to our providers about their patterns of ordering and how they practice and trying to, again, standardize this. They're doing similar work currently in our operating room with looking at the materials they're using in the supply chain and how, with bringing awareness to the cost of certain materials, they're able to standardize that and ultimately reduce costs for products by, again, standardizing things. And like I said, the same was true with our opioids, bringing awareness to how providers are prescribing in their practices. We were able to raise that awareness and ultimately decrease the number of opioids that were prescribed.
Great. So, when developing a robust data visualization platform, what are some of the key functionalities and policies which optimize the use of the platform, to drive care improvements in an organization?
A lot of it comes back to those informatics principles of, putting the right information in the right place at the right time. So making those data visualization tools readily accessible in a workflow that providers are familiar with and likely to use, and presenting that material in a way that's easily digestible and actionable. Those are the things that I think we've seen the most success with. Certainly from our lead work, we took a lot of data and put it into different places in the workflow, but have ultimately achieved improved outcomes in screening for these things by making sure that data, be it coming from outside sources or our own internal sources, is available to the providers in the right place at the right time. And then again, like I said, making it actionable so that they're able to order those lead tests or those lead screenings when that's necessary. So I think most of the success we've seen with our data visualization is using a tool that's available and actionable to providers.
Great. So how can data visualization identify patients who may be at a higher risk, and enhance clinical care and screenings, like identifying children at risk for lead toxicity?
Yeah, data visualization is really important in those scenarios where we're trying to do screening, which require multiple complex data points. For example, in those patients at risk for lead toxicity, we need to understand their zip codes. And rather than requiring providers to go out and search for where a zip code may lie and whether that's a high risk area, bringing all of that information into our EHR and presenting it to the provider in the form of an order set that suggests and automatically checks those things has really been a tremendous opportunity. It also raises the awareness that they need repeat screening if that's indicated for those particular patients. Again, we've seen similar improvements in care with our opioid work, like we mentioned earlier as well. That data visualization around provider ordering practices has really improved the care that we're able to provide.
Great. And so my last question is, what are some of the major clinical care improvement projects that Akron Children's is currently working on? And what are some of the key takeaways on those projects that other organizations can look to?
So I think when you look at what we are trying to achieve from a perspective of not only just clinical but operation, some of the projects we're currently involved in is, we are involved in Center of Excellence, which Sarah talked about, which is our spine centers and other centers that we are propping up. That's going to be very focused on creating destination care for kids that may not have treatment available in their local or regional sites. And so we will be able to provide that for them. We're also enhancing our telehealth significantly, as is every other health institution in this country, to really meet the patient where they need to in their own comfort of their home or offices, and thereby minimizing traveling as much as possible. Other things that we're currently involved in is our digital healthcare strategy. Is really understanding the post-COVID world and understanding how this is going to transform how we need to do business in the future from a clinical perspective, from an operational perspective, from a patient-centric perspective, and also from the point of how we deliver care. So the digital healthcare strategy that we are putting in place, which has the clinical tie-in, trying to understand how we go about creating efficiency across the organization so that patients and families can seamlessly come into our organization and have access to the care that they need, and also have the information they need to be able to understand what's going on. And the same thing will transform on our side from our clinicians to be able to quickly and efficiently provide that care to those individuals that are seeking care. So those are all things. And then, of course, finally, from a clinical perspective, where as we mature organization and address the challenges, we cannot say enough about the analytics that's needed to be able to support all of the work that's needed post-COVID to address our organizational mission, but also pivoting to the change in the healthcare landscape that allows us to transform our organization to meet those challenges of the future from a clinical perspective.
Great. Well, it sounds like Akron Children's is doing a lot of wonderful projects. So thank you so much for your time today.